Yes.
So, dear friends, meeting with the last concluding lecture on the mental diseases from the organ of medicine. We have finished up to the aphorism number 229 in yesterday's lecture. And last two lectures, we are discussing the mental regimen as Hahnemann have explained while dealing with the first type of mental diseases because those are rather difficult disorders to be treated. In fact, most difficult from the homeopathic point of view as well as from allopathic point of view. Hahnemann says over there they are generally incurable from allopathic point of view. They just go on palliating or tranquilizing the patients on the certain heroic medicines, but never gets completely cured. The cases of paranoid schizophrenia, cases of depression, the cases of obsessive compulsive disorder, and patient goes on taking the allopathic medicines for longer time of duration without any permanent result. And this happens with such types of diseases because those are the diseases which are resulted from the suppressed corporeal diseases. And then what the physician should do, how the physician's behavior should be there with the patients, in what type of pain states of patients, what should be the physician behavior. Everything he has explained in 228, and then in 229 he has explained few more important things that in such types of cases where your psychotherapy never plays a very important role, or when you try to give psychotherapy, patient takes it on bad part, and many such things, it only and only requires the internal antisoric remedy, and that you can give unknowingly because you can dissolve your medicines in the food of the patient or in the drinks of the patient, and patient can consume without knowing, and patient can get cured over there. Those disorders generally one requires a proper institutional treatment also, which which can settle. But such institutions should be very cleared enough with a good intention. It should not be just a madhouses. And that difference he has mentioned, and that's why there is one footnote to the aphorism number 229. A short footnote is there, and then we'll turn towards the 230. What he says in footnote number 126, the treatment of the violent insomniac and melancholic can take place only in an institution, specially arranged for their treatment, but not within the family circle of the patient. So if the patient of such a nature comes to you, who is absolutely maniac, who is in a violent mania, who becomes so destructive, never comes under the control. Such types of patient require the institutional treatment, and we should be arranged so properly that the physicians who are treating such types of patient in such institutions, their behavior should be very clear with the patient. It should not be harassing, it should not be persecuting the patient. And that aspect he has already mentioned in 228, that the physician's behavior matters a lot in treating such types of diseases. And to conclude this, that what how the physician and what homeopathic physician should do, as well as how the antisoric remedy will going to cure that patient. He explains it in the aphorism number 230. And what he says in 230, just go with. If the antisoric remedy is selected for each particular case of mental or emotional disease, there are incredibly numerous varieties of them. So there are varieties of such types of psoric disorders, mental disorders. Variety. Because they are the most difficult. They are aroused because of the suppressed corporeal disease. And what he says, mental or emotional disease, be quite homeopathically suited for the faithfully traced picture of morbid state, which, if there be sufficient number of these kind medicines known in respect of their pure effects, is ascertained by the indefatigable search. Indefatigable म्हणजे अविश्रांत search for the most appropriate homeopathic remedy. all the more easily, and as the emotional and mental state constituting the principal symptoms of such patient is so unmistakably perceptible, then the most striking improvement in no very long time, which could not be brought about by physicking the patient to death with the largest, often repeated doses of all other unsuitable allopathic medicines. So you'll observe this many times. The patients were there on strong allopathic doses. The psychological disorder patients are they are always taking many allopathic medicine. And when they consume that, they their weight goes on increasing. They put on their weight. They become slowed. They become dull. They become drowsy, and they never remains in the life. They are going away from the life. Day and night, they becomes drowsy and wants to sleep. Their interest in the life is lost because you are not treating them, you are not curing the disease. What you are doing, you are just tranquilizing them in order to tackle. But that will tackle only the situation. It will not cure the patient. Hahnemann says such types of patient, if you want to treat, it requires only homeopathic remedy. But you have to catch very clearly the state of the patient. The way patient presents matters a lot. There are many patients. I have seen one case which was, in fact, very acute maniac patient was brought to me by one of my student, and he was so suspicious. It was so suspicious that he never um, even he never believes his parents also. If parents starts giving him medicine, he feels that they are doing some harm to him, as if they were poisoning him. And that thought was very much. They have given the ECT to that patient, everything but nothing but, and diagnosis was it is a paranoid schizophrenia. And he was not consuming, he was not ready, and he used to become very violent. It's quite difficult to handle for their parents. His parent was one of my teacher in school age. He was in fact a principal, and when he came along with his son, at that time, basically he was absolutely disturbed because of behavior of his son. And son was brought over here that I'm not going to give him medicine, but I'm going to just talk with him. And he was brought to me. So I took his case, I talked with him, and I said, I will not going to give you medicine, etc. Because if I say that I will going to give him medicine, immediately he becomes suspicious. He himself told, doctor, if you are going to give me a medicine, I will not going to take. I'm sure that why my father has brought me over here towards you. I will not consume any medicine. Absolutely. And if you forcefully put it in my mouth, it will be harmful. I don't like that. So he was very in acute maniac state. I just talked with him, each and everything, and asked him, yes, I will not going to prescribe any remedy. You can go, and asked his father to meet me after some time. His father came to me. The case was very purely of a hyoscyamus. I have given hyoscyamus and asked him not to give him directly, just put it in his drinks when he's consuming tea, dissolve the tablets in tea and give it to the patient. This was the first time I have worked with. In fact, it was a long time in 2005 or 2006 I have done this, and I have given it to the patient. To my surprise, that hyoscyamus worked beautifully. After 10-15 days, the fellow came directly without his father to me. He said, Doctor, I want to take your treatment. He was not knowing that he was under the Alzheimer's effect or he has taken the Alzheimer's. But he said only one thing, sir, whatever you have talked on that day and you have not given me medicine, that made me up. I have appreciated that, and that's why I considered that I will take your treatment. And he gradually came out that situation. No other allopathic medicine he was consuming. He was refusing them, but he becomes calm and quiet. And then in the evening, his father met me and he said, Doctor, whether my son came towards you? I said, yes. What he was saying? He said that I want to take the treatment. Then I talked with him. He said, after giving those doses, whatever you have given, made the difference. He's becoming tremendously calm. He's not harassing us in home. And basically, he started taking food properly without abusing or anything. And everything happened in a nice manner. So if your remedy touches the patient's inner core, it definitely works. Only thing is that you have to catch the state of the patient in such types of cases, and you have to find it out exact remedy for the case. And such disorders can only yield to the homeopathic treatment and not at all to the allopathic treatment. With allopathy, he was taking allopathy since 3 4 years without any reason. Because it was just they were giving him tranquilizers and he was under that control and he used to remain drowsy and he becomes disturbed. Very intelligent fellow lost his intelligence because of that. So that's what Hahnemann says, that these remedies which are chosen on the state of the patient, you can find it out a very perfect remedy and it works beautifully in such types of cases. And what he further says, indeed, I can confidently assert म्हणजे ठासून सांगणं, from great experience that the vast superiority of the homeopathic system over all other conceivable methods of treatment. So whatever may be the conceivable methods of treatment in allopathy, there are many more. The psychotherapy, the electroconvulsive therapy, then the medicines, all those methods were there. He says that homeopathy is the most superior in over these conceivable methods of treatment in such types of cases. Over all other conceivable methods of treatment, it's nowhere displayed in more triumphant light than in mental and emotional diseases of long standing. So actually, it has not shown to the world that homeopathy plays a very vital role in such types of diseases. Homeopathy is wonderful in such types of diseases, which originally sprang from the corporeal maladies and were developed simultaneously with them. So, first variety of mental disease is only and clearly tackled if you give a right remedy to the patient. There are many cases of OCD comes to homeopathy. I have treated many more. There was one patient who used to come to me. That lady she was not giving a chance to touch anything in the inside house, any household thing. All family members, they used to remain in one room and she used to remain in another room. And she was not ready to touch anything, even food utensils. If anyone touches that, she used to wash it with the soap. She used to require daily one soap. That was the obsession. She used to clean the things again and again, again and again. Her husband was absolutely in a VP mode when he was explaining all those things. Doctor, since last 3 years, we are absolutely harassed because of her behavior. And she never listens anymore. She never accepts anything. She is taking all those medicines. We are treating her with psychiatrist from the Srirampur, psychiatrist from the Pune, Nasik. We have seen, but nothing worked. She is not at all listening to us. And that problem is there with the patient. And she was absolutely in bad mood. She said that it becomes damaged. Once you touch, it becomes damaged. And that infects me. It should not happen. And she used to clean it again and again. All those things. A typical syphilitic washing mania. I have given her syphilinum directly in 10 potency, 3 doses followed by placebo. Within span of 1 to 2 months, gradually she came out of that washing mania. It takes nearly about 6 months to get completely cured. But gradually that thought which was obsessed in her mind got settled. So such varieties of cases which you can get, those are first variety of mental disease. One patient was brought to me from a village from near Sangamner, and she used to mm, have a headache, and what she fixed idea was there in her mind that because her blood becomes less in her body, because of which she has a headache. Some doctor just told her that it might be because of you have anemia, etc. And she said that you just give me a blood. And she becomes so obsessed with that, she used to change the doctor. Within span of 2 years, she has consumed 36 bottles of blood. She was so obsessed with that. Unless and until I get the blood, my headache will not stop. And she was brought to me. Then whole case was explaining only one thing. It is a rather rigid fixed idea in her mind causing her damage. This is again a first variety of mental. I have treated her with Thuja, and Thuja worked wonderfully in that. So such types of cases you often get, and if you get a right remedy, they are easily tackled. But if you don't get a right remedy, these are most difficult cases to be treated. It's not the failure of homeopathy. It's not the failure of homeopathy. It's the failure of homeopathy to find it out a right remedy. And it happens many times because many times we never get clear-cut picture from the patient. But once we get such clear-cut picture from the patient, it's quite easy to reach and tackle those cases. So yesterday also I have shared the case of one very good professor who used to be a very good orator. Wonderful case of depression treated with the lachesis and cleared completely. So we get such types of ample cases in our practice because they were already disturbed because of all those medications they have consumed. Hahnemann says this is the only method which can cure those patients. So that's what he wants to explain in that 230 aphorism. And now we have finished one more big topic, the mental diseases, right from aphorism number 210 to 230, a completely devoted session for the mental diseases. Tomorrow we'll start with the next variety of diseases that is called as an intermittent diseases. Again, very thoroughly explained by Hahnemann. And we have to learn their types, the aspects, the management, because it is an era where we get ample cases of intermittent diseases. So how to handle all those, that we have to learn. So that's all for today. If there are any more queries, we can have a chat. Otherwise, we can conclude. And those again, for all of you, if you are interested to learn how to approach rheumatic cases with homeopathy, the homeopathic approach towards the cases of rheumatology, there will be a seminar arranged by Pune Homeopathic Association on this Sunday between 9:30 to 1:30 at Pune Hospital. If you are interested, do come. They have given one specific concession. Actual fees are 600 rupees. But for all my students, they have given 200 rupees concession, and you can enroll by telling them that you are my students and enroll with 400 rupees. So those who are interested, they can join. And if there are any query, we can have a chat.
हॅलो.
हा
हा सर, सुहास बोलतोय.
हो
सर आता जस्ट तुम्ही आता ओसीडी बद्दल बोलला.
हम्म.
सर मला थोडंसं कन्फ्युजन होते. जस्टच एक पेशंट झाला, तो म्हणतो की डॉक्टर साहेब मला घरामध्ये खूप स्वच्छता लागते.
हम्म.
इव्हन माझं बाथरूम वॉशरूम जर कोणी यूज केलं
हम्म.
तर ते जोपर्यंत मी क्लीन करत नाही तोपर्यंत मला बरं वाटत नाही,
हम्म.
किंवा त्याची घाण मला होईल किंवा घरच्यांना इन्फेक्शन होईल असं त्याचं म्हणणं आहे.
हम्म.
पण ह्याच्यामध्ये रुब्रिक कसं घेणार आपण? म्हणजे क्लिनलीनेस मॅनिया घ्यायचं का हा ओसीडी झाला पेशंटचा?
नाही, आता कसं असतं की तुम्ही तो डिसीज लेवलला गेलेला असेल तर तो कंपल्सिव्ह डिसऑर्डर म्हणून रुब्रिक येतो. इन युअर
बर
कम्प्लीट रेपर्टरीला तर मला हा रुब्रिक मिळेल. केंट्स रेपर्टरी मध्ये हा रुब्रिक नाहीये कंपल्सिव्ह डिसऑर्डर.
बर
तुम्ही तो
बर
कंपल्सिव्ह
बर
डिसऑर्डर घेऊ शकता. दुसरा
बर
वॉशिंग मॅनिया म्हणून पण रुब्रिक तुम्हाला मिळू शकतो. बरं,
बर
याच्यामध्ये तो खरंच तसा आहे का? मॅनिया म्हणून असेल तर तो मॅनिया म्हणून घ्यायचा. का तो पेशंट
बर
फास्टिडियस, तो जर नुसताच
बर
फास्टिडियस असेल परंतु तो मॅनियक नसेल. मॅनिया म्हणजे वेडेपणा,
बर
आणि फास्टिडियस हे नेचर आहे. दोन गोष्टींमध्ये फरक.
बर
फास्टिडियसनेस हा जो असतो हा त्याच्या नैसर्गिक सवयीचा भाग आहे. ते त्याचं नेचर आहे.
अच्छा
प्रत्येक गोष्ट नीट पाहिजे, व्यवस्थित पाहिजे. परंतु त्याची अति होणं म्हणजे मॅडनेस. म्हणजे
अच्छा अच्छा
एखादी रूम झाडली आणि दर 10 मिनिटांनी तो झाडतोय तर तो मॅडनेस झाला.
बर
देन इट बिकम्स अ
अच्छा
मॅनिया. टिल दॅट पिरियड इट इज नॉट अ मॅनिया.
ओके सर, ओके.
अकॉर्डिंगली यू हॅव टू थिंक अबाउट इट.
ठीक आहे सर, चालेल, काय हरकत नाही. थँक्यू सर.
So we'll conclude today's session. Tomorrow we'll meet at the same time. Thanks a lot and be there. We'll have a lot of things to be learned. Thank you.
थँक्यू सर.